This is WUB, Wake Up Belize Morning Vibes. I'm Nuri Mohammed for a Friday morning session. And as promised, our guest this morning is neurologist Dr. John Sosa. He has been our guest over the last few years. I've been inviting him periodically to come and to talk about certain areas that are important to us in our common conversations. Sometimes we don't pay much attention because it's not affecting us at that time. But as we live and we come in contact with these ailments, if I could use that term, then we focus on the information that is being shared around that particular matter. Today we want to talk about stroke, we want to talk about dementia, and we want to talk about autism. Welcome, Dr. Sosa.
Yes, Nuri, thank you for the invite. Thank you for being able to present again to your listeners far and wide and here in Belize.
Yes, sir.
So thank you very much.
We look forward to also you calling in, audience, and asking Dr. Sosa your angle of any one of these areas of concern. I want to start with this, Doctor. What are the early warning signs of strokes that Belizeans can watch out for?
You know, we always get asked that question. So actually there is a protocol, a way how you do things developed for a long time now, where they try and promote it to the public, and it's a thing that they call FAST. So everyone should know that if your face starts to twist, you should take that into account, or if your arms or legs get weak or numb, right? Or if your speech gets affected. And the T is a time that you need to get to the doctor to make sure that you get treated properly. So we try and encourage people to learn what FAST is. Obviously enough in Belize we don't do enough public service. So people sometimes come 2 days later with their problem, and by that time, well, everything has happened and you really can't do anything much. Right?
Can you go over those four things?
The FAST, F is
the face.
Your face.
Yeah.
If it's weak, if it's numb, it goes to one side, right? That is a concern that you should note.
Is there anything that can fool us? In other words,
well, yeah, because
the twitch, maybe because you drink too much coffee.
No. Usually people see their mouth go sideways.
Okay, so
right?
you will feel it right away.
Go sideways, and then that is a warning sign that
Okay.
a stroke is happening or is about to happen.
Yeah.
The same thing with the arm or leg getting weak.
Okay.
Or numb, or like not belonging to you.
Okay.
And
No, but it's not numb, and I don't mean to interject, but I'm trying to make it as easy for sometimes hard-ears people who want to hear something and they want to deny it. So sometimes you get cramp in your leg.
Yeah, but that's different. I'm talking about the whole thing goes dead.
Like it go.
Yeah. Right? The whole thing goes dead or get weak and you can't move it.
But wouldn't that mean that it's already on you? You know, it's on you?
Well, that is why you need to see a doctor as soon as possible.
Quickly as possible.
Because sometimes you can actually get the clot with medications out of the way, you dissolve it, and then your stroke improves.
So you said the clot. So is it being caused by a clot in the brain?
Most times a clot gets in the artery, and that blocks the flow of blood, and then behind the clot, your brain goes dead. So if you dissolve that clot, your brain gets oxygen again, and then you recover. Right?
So that means that the quicker you get to
the better.
Yeah. But suppose you did a kayo and you try to catch bus and
you won't get stuck.
You won't get stuck. You're in trouble.
You're in trouble.
Yeah. So is there any I'm thinking KHMH or one of the other major areas in the district, but can you get to any health provider that might be able to advise you?
So actually, unblocking that clot takes specialized medication and specialized training on how to give the medication and when to give the medication. So a doctor like me, a stroke doctor, is one who decides that.
Okay.
So what has happened in Belize, unfortunately, is that we have a very severe shortage of doctors like me. We should have 5 to 10 doctors like me.
How many neurologists are in the country, by the way?
2.
Wow. 400,000 people and we still only have. What's causing that, Doc? Is it that? Because I know you're one of the highest paid in the scale of medicine. I'm not saying in Belize, but one of the highest
not in
paid.
Belize, but other places.
So
yes.
people get trained and they want to go elsewhere.
Well, actually, they don't even get trained. Most of the young doctors have a financial constraint. That's the first thing, right? You need support. Unless you want to get your scholarship, like I can get scholarships for everything, no, but not everybody can do that.
Yeah.
That was just my thing that I need for studying. I have to figure out a way, and I want to figure it out. So I went and got scholarships for everything that I always did from high school on. But that kind of hard, no? That takes some motivation in study. So there's a financial constraint, and then there's a lack of awareness on the part of higher authorities, all governments, on what we actually need. Because in the past, I've done like little reports, giving it to like a minister or whatever, and say, you need so much of this, so much of that, so much of that. Nobody paid anything mind. And every now and again, they go through that whole routine as a government to find like where our needs are, but nothing will happen. That was one. Now we have to spend money basically, on
exercise and
on whatever we need to get done, no, for our health or whoever wants the info.
So doesn't that put, and I understand, they are prioritizing and they're saying, we don't get as much brain problem as we might have.
But there is a ton of brain problems because stroke is an epidemic in Belize.
Yes.
Because everybody basically got sugar pressure, no? And that's the way most times give you a stroke.
Okay. So your sugar and your pressure out of control is what leads to this.
Exactly, most times.
Yeah, I see a lot of people, and this is this like one epidemic of fatness and overweight is like almost worldwide nowadays, not in developing countries of the South because people don't have as much to eat, but certainly in the so-called West, people are overeating, they're indulging, and even in our developing country in Belize, we got a lot of fat people. Doesn't that contribute to those kinds of...
So what we need for that, try from when kids are small, as a society, try train them to eat properly, no? Because we eat wrong. We don't eat the correct thing, no? And we eat a lot of carbs. And we eat a lot of processed foods. And that kind of thing. But we have to eat more natural food, more locally grown food, basically.
So, how long does one have once you start experiencing the fat? Once we start getting those facial things there?
So, if you can... The thing is, the time, we have certain time constraints set out for when we want to unblock a clot for stroke. So, you have to try and get to a doctor as quickly as possible. Because when you get to the doctor, then you have to do a CT scan and some blood testing, right? Because we have what we call criteria for giving you the medication. So if you will get all those things very quickly, before 3 to 4 hours, then you may be a candidate to get the clot busting medication to unblock the clot that is giving you your stroke. Now that is like 85% of strokes. Because you have strokes where you actually bleed. That you can't do nothing about, that don't happen. You know, have that and not a clot, that and not bleeding with something pop, right? And you have blood in your brain.
Is that an aneurysm or?
No, that can be just a small blood vessel that pops.
Okay.
It doesn't have to be actually an aneurysm.
Okay.
But you have small little tiny blood vessels in your brain because the brain has to get supplied, and when they pop, they bleed. So you can bleed inside the brain tissue itself, and that kind of problem comes usually from very high pressure.
Okay.
And that you can stop.
When we say high pressure, what we talk about?
Pressure is above 180, 110 usually.
Okay.
All right. So that kind of problem, yes, you can't treat with a clot buster. Because the clot buster is to break up a clot, but it's not a clot; it's not bleed. So that's different. But only like 15% of your strokes.
Okay.
So the vast majority are just strokes where you get any clot, the artery get blocked up, the brain behind the artery not get fed with the oxygen it needs, it dies or starts to die. And that is when you try and find a doctor as quickly as possible. So ideally, all our regional hospitals should have the medication and the doctor to treat it. But that not happen also.
I see.
Right.
So that the window, I'm not sure, and I may be asking you repetitively here. What's the window from I get one stroke in a PG and I need to
Yeah,
get it.
ideally you want to say doctor within an hour. By
Within
60
an hour.
minutes. For everything to start to happen. So that
So
like
by
3
any
to
means
4 hours.
necessary, you need to get to a facility and not wait.
Yeah, but if you're at PG on at night, you won't get stuck and no plane flying at night.
Yeah.
And if that day you don't have money for the plane, you still can't go.
Yeah.
And you take too long on the road, no?
All right, we normally see people who are victims of stroke, freeze up. Sometimes it's one arm, sometimes it's a leg. But then I've also seen people who have had strokes and have recovered from the stroke. Can you tell us about that?
So it depends on the site in the brain itself where you get the stroke.
Okay.
70% of strokes, people don't know they have one stroke.
So you mean you're walking around?
You're walking around with a stroke because the stroke is small in a certain area that doesn't really affect you. You don't recognize it, you don't know. Or something minimal happen.
But is it going or is that growing? It's going to get worse as it...
No. The stroke happens, it's small. And you never know because it never do you anything.
Yeah.
So 70% of strokes are like that.
Wow.
So 30% of strokes, we know it happening. Right? Which is a curious thing. So with that 30%, it depends on which place in the brain you have the stroke. You have a stroke just affect your speech to talk, or just affect your speech to understand, or just affect your face, or a hand, or a limb, right? So when the strokes are bigger in a wrong place, is that when you get damage, right? So it depends on where, or you can have stroke that affect partially your vision. So it depends on the site where you have the stroke in your brain that you get a damage.
But the recovery can be what percentage of going back to normal?
It's not that it's a percentage, no. It's that if you get one stroke, say deep inside the brain in a place called internal capsule that gives you your movement, and you get one little tiny stroke in that area in a wrong place, you want to stay paralyzed for life.
Wow.
With one tiny stroke. And then you could get a bigger stroke in one part of the brain, for example, the outer part of the occipital lobe, and you didn't notice you had a stroke, for example, right?
Is there any prevention regime for making sure that I don't fall in that category of even having a stroke?
That's where good lifestyle and exercise comes in.
Okay.
And control anything that you have as like diabetes, hypertension, high cholesterol, high triglycerides.
Okay.
So a good lifestyle and a good diet is the best prevention, right? So lifestyle includes exercise.
You told me over 30 years ago, and excuse me for bringing something you told me personally in public, but I think it is important, where you said to me, because we were discussing that disease, you said if I ever got diabetes, I would take insulin.
Because it worked the best.
Yes, but I want to know, here's my question. There's so many people out there on other drugs, the pills, the metformins, the gliberides, etc., who are not getting results out of that regime, but they're afraid of the needle. I guess it's the needle that they're afraid of. And I was always affected. I never asked another doctor because I thought it was your personal opinion, because you said if I got I would take insulin. But talk a little bit about that, because a lot of people, if it sounds like what you're saying, if you had a choice, you wouldn't mess with them pills. You would go direct to the
insulin. Well, two things. You have insulin you can give without a needle, but the cost is a problem.
Okay.
The cost is very high.
All right.
So if you're
this is
kind of well off,
this is without a needle?
Yes, it goes on the skin. All right.
Okay. You mean what is it? A tape or?
No. It's like a little gun that gives you your insulin. Right? Sprayed into the skin.
That's available in Belize?
At times, yes. Not all the time. But people sometimes bring their things from the US.
Okay. Right.
And then you have different types of needles that you can use. Some ready-made, some that you buy the little thing that you have to actually pull up. I mean, the needle won't hurt you and leave it, but eventually you get used to it. No?
Yes, of course.
And you go changing where you give it, no? So you'll give your arms, you'll give your thighs, you'll give your belly. You're going to change where you give your insulin.
Right.
So you not juke one spot all the time over and over.
Yes.
People adapt to getting their needles.
But why? Why do you say that is superior Because the medical
Because
science is that.
no, because our body, in our pancreas, produces insulin,
Okay.
right? But when the pancreas not got no more insulin, or can't make it, because the cells who were supposed to make it no work good because diabetes kills the cell. Well, then what we need to replace the insulin that the body make, right? So if naturally my body makes insulin, and I don't have it, I better give myself it. Because what the pills do, that try force the body to make the insulin or use the insulin they have.
Okay.
That they use it
So
better.
the pills, they're not insulin in another form.
No. They make the body try make more insulin or utilize the insulin in a better way.
Many people say that there's so many side effects of these medications. You get fat, you get thin, you get many, and some people say that over a period of time, they don't even feel the effects of their metformin or the.
Well, many people are uncontrolling beliefs because we just eat too bad, man.
Okay,
We got
so we
diabetes and
do it,
we
but we still keep the same.
yeah, we not
lifestyle.
change our lifestyle.
All right, yeah.
Right, you have to eat properly. If you eat properly, the things won't work for you.
Oh, okay.
Most times.
All right, okay. So it's not a problem with the pill as much as it is with
Problem
the
with
person.
eating,
Yeah, we also. Is neurologist, Dr. John Sosa, and we'll open the phone lines after the next break so that you could also ask him some questions. Doctor, the next area of great importance to a lot of people in Belize is this area of dementia. Dementia, because a lot of us experience memory loss. And when you get to a certain age, you begin to wonder, is this Alzheimer's or dementia creeping up, or is it that I just forget where my keys are? And so you could maybe help us to make that distinction.
So I've said it before, right? Usually, if you notice that you get forgetful, that are not dementia, because you don't notice.
Right.
So you have a thing called age-related forgetfulness. So as we get older, we get forgetful. That's normal. That's a normal part of the aging brain. That when it starts to affect you, that people notice and you don't notice that you have a memory issue, that then you should seek some kind of advice. Because people don't notice that you're forgetful, but you know they notice it. Or people start to hide and stuff and can't find anything, right? And the family notice, right? Or people start to not remember their family, like cousins and people who they don't say all the time, but they don't remember like the family that come to visit, and you start to say, wait, but you know, you're supposed to know that person, things like that. Little things you start to notice. And then you start to might think, well, you have a thing called mild cognitive impairment, which half of the time go to dementia, and half of the time stay right so. You just stay forgetful more than usual, but you don't reach dementia. So dementia actually is when you forget and it affects your daily activities, right? That you can't function properly. That's when dementia is established. So your daily activities that you should be able to do, and as it progresses, it gets worse and worse, no? So initially you just get very forgetful for doing certain things. You forget to take off the light and the stove, and then eventually progress that you forget that when you go bathe, you put in your clothes one certain way, or you dry off, or you just wet but you're not soapy. You progress more and more, and then you start to forget your close friends and then your family.
Yeah. So, and really I'm asking about this question because I talk to people who are afraid that they're losing it a little bit, but are conscious, which means that they know they lose it.
They know they lose it because they get age-related forgetfulness.
Right, you know, they
Most
lose
times,
it,
right?
but then they get scared because they feel like, oh boy, you know. You take, for example, what you're saying here, doctor, is that in fact there is a natural aging process that we are going through. And what's important there is, what is that normal age? Is it early 50s, 60s, 70s?
Usually
80s?
when you reach 16 and past, you start to get more forgetful.
All right, it's a little bit around that age.
Yeah.
So my listeners and my viewers would need to know that's around the age that you start seeing that natural forgetfulness. You'll drop your key, but you're not sure where your key is, and you look all over the place, and, you know, or like the famous joke, you look for your glasses, but your glasses, they're face, right? So, you know, and we make fun of these things, but there's a point of which it is not a joke anymore, because it is an early set on of
when they
this.
get too frequently and really they affect you, then you know.
All right, so what about now people in your family is beginning to notice that you're becoming forgetful, but you're not becoming forgetful in the sense that you really, you know, you're the bathe and forget to soap your skin, but you're really are forgetting things where you should have been. Remember, just yesterday this thing happened. And
that when you're supposed to get to a doctor to evaluate, no?
Check it out.
Yeah, sure.
You should go in. So what would a person who comes to a neurologist discuss in that diagnostic?
We actually have tests that we do. They're standardized tests,
okay,
right? That
right. What would be involved in that test?
So yeah, so the test actually checks your memory, their questions on your mood, their questions on the memory is not only a working memory but memory from the past. So different subsets of memory we check. We check the ability for, in a sense, be aware of your surroundings and yourself. We call it insight. We check if you could add and subtract, right? We check your interpretation of objects. We check if you can follow certain orders, things like that, no? And we go to score it. So there are things that we do and we score it. It's an objective thing that we can score. Not an Altrum thing. This is an objective long test that we do that we go score.
So me taking that test now to really see for myself, not only
anyone can do the test.
Oh, so you can print out that test and take that test, for example?
Well, yeah, you could actually go online and find it and take it for yourself.
All right. Okay, it's important because when you have a place where you don't have easy access to medical and doctors.
Yeah, the problem is the scoring. You have to know how to score it. Right? The doctor like me know how to score it.
I see. I see. So it's not a 100% type of thing.
You can print the test and do it, but that means you want to score it correctly.
But the score will be.
The score tells you if what degree of forgetfulness, memory loss, or dementia you have.
Okay.
All right.
I'm not trying to get people to self-medicate and self-diagnose. I'm just trying to broaden it because we're in a developing country and we don't have easy access to the information that you're giving right now is invaluable, my brother. Because where else do we learn this? And you have an aging population in Belize who are being affected, and you know as a doctor, being affected by these things. But where do you turn to get answers to avoid fretting?
Yeah,
when, you know?
So again, it comes back to one of the original questions, no? We need more doctors like me in this country.
Yeah. Because
people get a better service for everything, including when they need a dementia diagnosis and so. So we need like at least five more like me, you know?
Yeah.
And then it'll be easier for the general population.
Yeah.
Kind of got easier access. Right?
When does dementia normally, when should we be looking for it? Can you get signs of it from early 40s or it's always?
Yeah, so you have, the earlier your dementia starts up, we call it early onset dementia, the worse it is.
Okay.
So your guys on dementia will start in your late 40s, early 50s. And that are the kind of dementia you don't want to have, right? Because those are bad. They advance more rapidly, you'll get affected much more rapidly, and you die earlier, right?
Wow. So you could die from dementia?
Yes, because you stop eat.
You forget to eat.
You forget to eat. And then you stop move, so you just stay in your bed. Then infections come on easily and you're malnourished.
Wow.
Yes, that is the end of the dementia patient, right? Unless you die from something else, no?
Yeah, yeah. You forget your survival skills and you begin to deteriorate and die.
You forget even who you are, no?
Oh man.
Right?
Yeah.
So the earlier the onset of dementia, the worse it is for the person. And of course, a quarter of everyone over 85 has Alzheimer's.
Okay.
So that's just life, no?
All right.
Right. So if you live
what percentage over
a quarter?
A quarter of people over 85. So if you're dealing with people in their 90s, and we've seen our beloved brother who just had his birthday a couple of days ago, he's 109.
Wow.
And I think I spoke to him when he was like 99. And he was very cognizant. As a matter of fact, he made to drive the car around the city. And I was just blown apart.
Right.
And I haven't been with him for a while and really shocked when I saw this headline last week in Mandela. Mr. Bertie is now 109 years old.
I know Mr. Bertie.
No, what in a case like that does he become just a vegetable?
That's not just a vegetable, no? But when you start to forget everything and everybody, you lose your connection with your world, with your environment, right?
Yeah.
So you're just within yourself.
Yeah.
So you're like more like a plant.
Yeah.
And the plant in one corner, they just water it.
Wow.
They water your food and water.
So you need absolute care.
Right, you need 24-hour care.
You cannot take care of yourself
No.
when you're into that.
Right.
Well, bless Mr. Bertie and bless those who are taking care of him. He's an iconic figure in Belize and a sign. You know, we always talk about we want to live long. But then I have friends who say, boy, if I have to live long and people have to take care of me, then I don't know if I want to live that long. But then those of us who still have a zest of life and want more. I could remember what the poet meant when he said, oh, there goes youth, if I only had it again. Because there's so much you have cognitively, but you don't have the energy to do it.
Well, you want to live long, but you want to live good.
Yeah.
But you have to prepare for that.
Okay.
Right? Because if you decide, boy, I want to drink where I want, eat where I want, smoke where I want, and just live bad, well, you know I live long, and if you reach a certain age, you want to live bad.
Yeah.
We have to prepare to live long and good.
Okay.
And that preparation, again, is just a good lifestyle, good diet, exercise, control any illness you have. That's how you do it, that's how you prepare.
Okay.
So your preparation is for your entire life.
All right.
That when you reach a certain age, you have prepared. Most are we not prepare.
Okay.
Right? So things go wrong.
Yes.
So you see people going in their 50s and 60s on big stroke and things go sideways and they die early. They never prepared.
Yeah.
Right?
So I'm repeating what you're saying. If you want to live a good life, not how long you'll live, because that's decided beyond you. But if you want to live a good life and a healthy life, you have to begin from now.
Right.
Exercise, proper diet, doing what you know is the right thing to do.
Right.
And those prolong your very self, your body, etc., etc. But if you're do what we do on weekends and what we do during the week, etc., and then still expect to live long,
Yeah, you want to kill your brain, you want to kill your body.
we contradict our own self. So it's very important. So health is in our hands.
Right.
Health is in our hands. Health is not in the hands of the doctor. It's not in KHMH.
Everybody have to take care of themselves.
It's a matter of you dealing with yourself. This is important because most of we want to take a pill and live hard. Just give me a pill. And I heard somebody say a long time ago, many times doctors advise you how to live so that you can be here a long time. We walk out of the office and say, you know, my grandpa lived to be
Well, you have a genetic thing for living long too, no?
Yeah, so.
But
All right,
good.
let's go on to another aspect of this dementia. Is there a way when you first begin to notice memory loss, etc., is there a way to slow it down?
Yeah, you can slow it down, not significantly, a little bit, with brain exercises, right? With good nutrition, again, and there are medications that can help to slow down the progression of your dementia.
Okay.
So, but the medications slow it down just a little bit. And there are very few other things that would help. You have some scientific studies that say ginkgo biloba helps just a little bit with your brain function and memory. But you have many more studies that say it does nothing, right? So you have some studies that say that vitamin E helps a little bit with your brain function and memory. But you also have some studies that says it doesn't really help that much. But the only vitamin that actually helps a little bit is vitamin E. Because I believe we like drink like nerve food and be complex and anything that don't go for your brain. That's a fallacy.
They're not good for the brain. They
don't do anything.
They don't do anything
not to your brain.
Yeah.
You get me?
Yeah.
So what you want to exercise the brain, good reading, good music, watch good things on your phone or on your tablet, on your TV, no junk, right? Exercise your brain.
Yeah.
Do crossword puzzles, whatever, as you get older, and have communication with people. Conversation is important, no? That you have people you talk to, because if you're isolating by yourself, eventually your brain will stop work.
Yeah.
Right.
Especially if you can't find people that could really have a conversation and engage you. Really
exactly.
got you
that part important, no?
Yeah.
Your social interactions.
Yeah. So being around simpleness and engaging in lone simpleness, all in the name of just fun and relaxation, may not necessarily be good for you.
Well, everybody needs to leave fun now.
I don't take about your break, I talk about lone that.
Well, yeah, that now help you.
Yeah.
You get me?
Yeah.
Right? Because you have to use your brain for something that it works, no?
Yeah.
Okay, and you have to feed it properly, obviously enough. And if you got dementia, you have to take the appropriate medications for the level of dementia you have. And those change too.
Yeah. All right, back. This is WUB, Wake Up Billy's Morning Vibes. Our guest is Dr. John Sosa, neurologist, and he's giving us an understanding of the intricacies of these dilemmas, like stroke. We're now talking about dementia. What can families do when they recognize this in their relative?
Now that's my question, right? Most times, one or two family members are the ones who get the burden of taking care of somebody like that. But that's hard, because taking care of somebody with dementia is a full-time job, and you need different people at different times, because a primary caregiver will get burnt out. Because of too much thing you have to do, no? Because you have to start to learn for bathing, feeding, dressing, make sure you get a bathroom, get clean. A lot of work, right? So the family always have to know that if they have multiple people to help, it's better than having one or two. That's the biggest thing.
What are some of the things you don't do though, Doc? Because we don't know. So what are the things we might be doing that we really shouldn't be doing with a person with dementia?
Well, you can't fight and quarrel with them.
Because
dementia people have that's why they have hallucinations and deliriums and things like that. You have to try avoid that because they get more agitated. All right? So you have to try avoid fight and quarrel. That's the biggest thing, no? Because a lot of times these patients, they're agitated. When they're too agitated, they need medication.
But what caused them to I guess it's a sickness, but I've heard of cases of taking up glass and throw it at you and
agitation. We call it agitation. Because the brain does, you see, your brain in the front controls for your emotions and your behavior.
Okay.
We call it a frontal lobe. So if your frontal lobe doesn't work the way it should, you get disinhibited or you lose control of yourself.
Okay.
Then you just do what your mind tells you to do.
So if you were already an aggressive personality,
you get more aggressive.
And then it's increasingly difficult to deal with you then.
That is why many times patients need medication for their agitation.
Okay.
Right? But make the family could help control it.
Keep them
calm.
Tranquilizer kind of.
Yeah, calm, no?
I see. What should you not do when you're dealing with a family member that has dementia?
What you should not do, you cannot assume that if they complain that they're just making it up. Because sometimes you don't only got dementia now, so if you got chest pain, you could express it. Maybe you got a heart attack, you can't ignore their complaints. Because many people ignore the dementia patient complaints and things start to go wrong, no? They got one belly issue, for example, one lung issue, whatever, and the patient complain, can they feel, right? But they don't believe them, kind of thing, they just attack out and they lie. So just because you have dementia, no mean you don't got other things, right? So you cannot ignore the patient's complaints.
Yes.
Right? That's the most basic thing.
How do you avoid, because what you're saying is that full-time job can make you burn out.
Right.
So how do you deal with that to avoid becoming an obstacle to that person that you're trying to help? Because if you get irritated and agitated, then you are making his or her
Which
problem
is
worse.
why we always encourage the people who are the primary caregivers. You need 1 day or 2 off every week for yourself. Like if you work and your time off, kind of work you to do, right?
Yeah.
That way you get refreshed. So you have to have someone take over responsibilities totally for a day or 2.
So doctor, what do I do? And I'm just looking at some of our real situation in Belize. My partner, father, mother, person in the house is experiencing last stage dementia, but I have to work 8 hours. And I am his or her primary caregiver. And I am tired when I come home. Nobody was taking care of him or her during that period of time just because of the reality. And then I have to go deal with it when I get
that happens a lot, right? Which is why we always ask, why try to find a family or friend or somebody to help you. Because you won't get tired. And then you stop taking care of the person. And things going cross with.
One of the reasons why we should not break off our family relations, right?
Exactly.
As though I don't want to be with you, because later on I might need to call upon you.
Yeah, you have to have people to help you, friends and family.
Another area is what systems actually and resources exist in Belize to address this area of dementia?
Well, I know you have some dementia patients at the what they call the old folks home again, me forget what they call it.
Octavia and Sister Cecilia?
Yeah. So I see some patients from them sometimes, right? But they have good caregiving in the sense because you have multiple people working, but that's a paid, the family have to pay something. That's a paid system. Right? So that exists. But most people just have their family home and try deal with them, no? That's how most people do, because there are no facilities where you can go. And we don't have like outpatient facilities usually, or truthfully, where you could take your family for the day, right? And they have what we call occupational therapy and you get some social therapy and things like that.
Well, maybe I might ask you this question lastly on dementia. If you had the ability to change anything within our healthcare system when it comes to this particular area, what would it be?
We need to open, you have daycare for kids, or you have daycare for elderly, right? So it would be good to have some daycare for elderly patients. But
Is
not
that
really
hard
but very low paid or free.
Okay.
Where people could use it.
Yes.
Because people can't pay, no? We don't got no money, so they pay kind of thing.
You would need a whole system for that, though.
Yeah.
If delivery.
Well, so that's an important thing. But we need more important things like proper medications in a hospital, proper supplies, make all the people get good access to good medication easier. We have more important things that other things get left behind, like mental health care and care for the elderly and things like that. Like they stay on the back burner, no?
Yeah. You notice I have not tried to associate dementia with mental health because that's another dimension altogether, and and it's just as problematic when you have a person who has mental issues in the family, particularly when it's a young person. But let's take this next break, and when we come back, we will touch the area of autism, and well, we have our first call here. Welcome, caller. Yeah, good morning, caller.
Yes, morning, brother Nuri, and good morning, Dr. John Sosa.
Morning.
Yes, sir. Welcome.
Yes, Baramuri. Good morning. This is Jaban Dekas from Helpage, Baramuri.
Ah, yes, brother. I recognize the voice.
Yes, I want to thank you, Baramuri, for inviting Dr. Sosa.
I need you to turn your monitor down, though. The feedback is going to get a problem.
Yes, Baramuri. Sorry about that.
Okay.
Yes, I was saying I want to thank you for inviting Dr. Sosa in because we are celebrating what we call Older Persons Week.
Uh-huh.
And it ran from Sunday last until today. Today is the last day.
Uh-huh.
But more important, the theme for this week is advocating for healthy and inclusive aging.
Ah.
And the era of healthy aging is very important, and you touched on those topic areas, especially dementia. Dr. Sosa knows me very well, so I wanted to ask him a very technical question. Dr. Sosa, there seems to be two schools of thought in terms of dementia and its origin. There seems to be one school that look at it from a generational point of view. In other words,
Genetic.
seems to run through certain families, and I have seen it where certain family areas, family members tend to have it, and it also seems to be triggered by certain traumatic experiences, particularly brain damage. Could you expand and tell me what you think about those two schools of thought, and what is your personal view on it?
So actually, with Alzheimer's disease and other types of dementia, you have a subset that is inherited or genetic. That's a smaller number. Alzheimer's, the new thinking goes is that its origin is an infectious immune system disorder origin, which means there's an infectious origin, and the infectious origin is from the gut or from the throat, right? But your immune system in the past, when you were younger, did not respond well enough to that injury and did not affected your immune response in your brain. And that's the kind of new thinking on the origin of the majority of Alzheimer's disease. So there are some dementias that are more genetically inclined, and like Alzheimer's, less genetically inclined, a smaller population. But you do have a genetic background, and you do have what I call an infectious immunologic background to the cause, not the etiology, may I say, to the cause of your problem. And obviously enough, if you're of a higher economic and academic class, you have less dementia because you just use your brain more, because dementia seems to be more prevalent in a lower economic or poorer people, no? And that may also have to do with the kind of diet you have. So that dietary input is also a thing that is part of the... So it's like multifactorial. There are different things that are presumed to cause your Alzheimer's disease, which is a major part of your dementias. Alzheimer's is 50 to 60% of all dementias. That's a major part of it.
Meaning it advances to Alzheimer's.
No. You have genetic Alzheimer's,
Okay.
but the major part is not genetic. It's more an infectious immune system problem in the past. And then you get Alzheimer's. That's a new thinking. That's a new
thinking.
Yeah, it's what we call theory. It's not proven. All right? But people are always investigating.
Yes, of course.
Okay? So that's a new thing that you have.
I want to ask another area, which is, and I text you about this, and I'm glad that Mr. Dekas brought it up in terms of genetics and hereditary. You know, and this is a sensitive area. I've already told you I was going to ask you this, but parents want to be involved in the best for their child. Belize on a small place. And I see my son kind of leaning towards this young lady, or my daughter leaning towards this young man. And because Belize small, I happen to know that in that family there, you got some genetic problems there with people have either Alzheimer's or dementia or some other genetic issue, is it ethical? Maybe I should put it that I discourage my daughter to move in that direction, to marry that boy there, or my son to marry that girl there, because of what I think may end up with my grandchildren being affected by that dilemma.
Actually, parents discourage their kids from certain relationships for other things much more frequently, I would think, right? Ethical or not, I'm not really sure, but I think people who are adults have a free will to choose who they want to be their partner, no?
Okay.
Right? So,
but suppose you see that partner.
Well, you can talk to your son or daughter.
Okay.
That no meaning.
But I guess I'm asking if that person has a mental issue. Does it necessarily come down to the genes?
Not necessarily.
All right. Maybe
right?
that's
genetics is not 100% thing.
Okay.
No, because I might have something, I won't have it. That don't know how it works.
Okay. Even in the mental.
Even in the mental health.
Yeah,
that's not how it works.
So I should not be worried that this person's father did a crazy house.
No, that
and I
actually,
like use crazy.
Yeah, I know that. I know actually how it works totally, right?
Okay.
Because you have other influences apart from genetic reasons for having an illness.
I see.
All right.
I see. Okay.
So, but we would discourage our kids on a lot of other circumstances.
Well, I know there's a lot of areas not go that direction, but I was just thinking, since I'm having you here and you are the expert, is that a concern that parent would have, that I wouldn't want my daughter or my son?
Well, they can express that concern, but that means it won't work. Young people do what they want.
But some of them are very influenced by their parents. Welcome, caller.
Salam alaikum.
Welcome, caller.
Hello. Salam alaikum, brother.
Wa alaikum assalam, my brother. Welcome.
Yeah. I'd like to ask Dr. Sosa, is there special brain exercise, such as what I do? I'd say I'm using brain exercise by singing old songs, reciting poems, writing, try to hold constructive conversation, such as the ancient history and that kind of thing,
Yes, sir.
And I also wanted to ask, is schizophrenic behavior have anything to do with, with the with dementia?
Yes.
That's my question, and Brother Noor, I'd like to try to reach you today because it's important to me.
Okay, I'll call you as soon as the show is over, Brother Inaja.
Inshallah. All right, my brother, thank you.
I will, sir, inshallah.
I'm trying to find a special exercise for brain.
Yeah, I need to do my exercise on the brain likewise, but I like that engaging conversation and reading book. But I like you to talk with this reading style where you want to see if you remember the words. All right, man. All right. Inshallah. So, what do you think?
So, schizophrenia is a mental health disorder.
Okay.
It's an illness. The origin of the illness is different.
Okay.
I can put it that way, right?
All right, okay.
But if you have schizophrenia long enough, you possibly could get dementia, yes.
Okay.
Right? Because of your mental health illness. All right?
Yeah.
But the two are not related or causal or effect. Okay?
They're not necessarily, they're not directly linked.
Exactly.
All right, okay. This separation between what affects us organically with the brain and its problems, issues, and what affects us mentally with emotions and personalities, etc., which sometimes can also be triggered by something organic in the brain. But there are two different sciences. And I know that whenever I ask you about something that is mental, you say, that's not my field, Nuri. Go talk to the psychologist, talk to the psychiatrist, right? But I think we don't, they cross over so much.
Yes. There are a lot of neuropsychiatric problems. You got neuropsychiatric.
Yeah, because you think that something is wrong with the brain itself, Anyway, here is another area, and that is autism. And I go now particularly to the words coming out of the United States and this new, what is he called? Not Minister of Health, the Secretary of Health, the Robert Kennedy Jr., who came into office with some biases in regards to vaccine and autism, because he's been on that campaign for about 20 years. In fact, I interviewed him in Belize when he was here about 20 odd years ago, and he was on the campaign at that time to try to discourage people, and he had all his data saying that autism was causing all these problems in Africa, etc., etc. Now he's the Secretary of Health in the United States, in a very powerful position. And last week, we heard them advance the idea that extra strength Tylenol should not be taken by pregnant women because they have whatever evidence it is that says that this will lead to autism. Can you give your opinion on that?
So if you go read, and I know many people have done this, right? Let me backtrack a little bit. There was one study published in the Lancet, I don't know, maybe 30 years ago, 25 years ago, that a doctor, well, not a doctor MD, a doctor, a researcher, invented this study to say MMR caused autism. And
MMR is vaccine.
Vaccine,
Yeah.
measles and mumps and rubella vaccine
yes.
in one shot.
Which is given to all children
Right.
at the age of what?
And the vaccine when they're
5-6
small,
months,
when
right.
they're small, no?
Okay, good.
As infants, right? So this person who invented this data was an anti-vaxxer, and about 20 years later, they catch up and say, "Boy, you know what? This was a wrong study. It's wrong," and the Lancet retracted that article. The Lancet is a UK medical magazine, but a lot of people got with that faint, no? But it was wrong medicine. And even now, lots of
So
things
you're
get published.
saying because of that,
People jump on it.
and they stop
And they
giving
be-
their children the MMR.
Some people, yes.
Okay.
But you had studies right away done immediately after which contradicted that one study. But it was published already, right? So many studies were done which said, no, that are not true. And then recently in Denmark, they finished a study with 2.5 million people, right, on vaccines, where they found that vaccines were totally safe and had nothing to do, especially MMR, had nothing to do with autism. And they also had a study with Tylenol at that same time, right?
Yeah.
Or acetaminophen or paracetamol. And these people also did that study with women who were pregnant and then had their babies. And they found out that Tylenol and acetaminophen had nothing to do with autism. And that's a published fact. With a big amount of people, big number of 2.5 million, right? An epidemiological study done retrospectively. What we do know is that if a pregnant lady has a fever, that fever can damage that baby's brain. That we know. If a pregnant lady has too much pain, unrelenting, that amount of pain can damage that baby's brain. We know that.
Oh, wow.
All right? So what does that mean? Tylenol is totally, or paracetamol or acetaminophen, is totally unrelated to autism because you have the evidence and the proof. So RFK Jr. cherry picks different doctors. You have individual doctors who will also be crazy like him, kind of crazy, and have their own beliefs without evidence. And he would pick these people and say, hey, this doctor said this doctor said that. But that's one doctor. That's not evidence-based medicine. And so he would cherry pick and say, oh, but this doctor said that, but that don't mean nothing. Because that's doctor opinion. Like if I say it, that's my only personal opinion. It means nothing. It's not evidence-based. Right? So the evidence, the published evidence says that Tylenol and vaccines have nothing to do with autism. Autism is actually multifactorial. You have all kinds of different reasons for it that we don't even know about. Infectious reasons, inflammatory reasons, autoimmune reasons, genetic reasons, all kinds of things can give autism.
When it comes to us dealing with our child that is autistic, what are some of how normal can we make that situation for that child? Because
Okay.
they're always so sweet.
Not always, but anyway. So this is the thing.
All the
right?
ones I met, them, man, they're just so,
So,
and,
so autism is divided in levels by the level of support you need, right? So some people who are mild, because it's like a spectrum, they call it. Some people are on this end, some people are on this end. Here very mild, here very severe. It depends what damage you have in a sense of your interactions outside your own self, right? Because some people can't socialize any at all, and some can do most of everything that normal people can. So your level of support goes from minimal support to the most support that you need to get, which is from 1 to 3. And we also subdivide those levels of support, but that don't really matter at this point. That's for like a doctor like me to kind of like figure it out. So if you need very little support for your autistic self or your kid, the individual, that's good, because with all kinds of therapy that you can get, you can basically live normally, right? And you have people who are living, who are autistic, who just have little issues, don't even know they have autism, truthfully. But if you have a person,
don't even know they have
exactly, that happens.
Oh, wow.
But they have like personality issues and interpersonal issues and
How can you
socialization
detect
issues.
that then?
They see a doctor. Sometimes for other things.
So separate autism from when a child's face changes and you could see, I don't want to use that old term that they use to describe that child, but that child is that child also autistic, or is that child, I really don't want to use that old term. You know the term I'm talking about.
What happens in Belize and all over the world is that we really don't think of what really is autism. Autism is a social interaction disorder, in a sense. Social interaction disorder. But social not only include how we communicate with speech. It also includes how we communicate non-verbally and how we interact, right, with other people.
Yeah.
So actually what happens with autism is that all of us are born with 20% more connections in our brain that we need. Connections that we call synapses and neurons. And as we grow in infancy, we lose the 20% we don't need. But apparently autistic kids, their connections are not good, the synapses are not good, and the connections get lost too slowly. And so we're hypersensory or hypersensitive to exterior stimuli, to what they happen wrong way. So if we're very, very hypersensitive in a sense, we totally disconnect. So we don't talk, we don't look at people, we can't play with other kids, we have certain behaviors that we do for cool our anxieties, right? Yes. Like we bang our head, or we turn around or we line up, different things, right? So it can be something very severe, needing a lot of support, right? And the support does not mean, let me make this clear, of your intelligence, okay? So around 30% of kids are non-verbal, so 70% are verbal, and around 70% of kids have totally normal intelligence. So you can have a kid with a level 3 support need with intelligence that is normal. So we know the talk about your level of intelligence, we talk about the support you need for live. You understand me? So when you have someone who needs a lot of support, that is when the parents, they need a lot of help.
Yeah, caregivers,
right?
yeah.
Exactly.
Yeah.
If you have someone that is mild, that's okay. And then you have you have like 28 different types of therapies that you can do for these kids.
Wow.
But I believe obviously
in Belize, that's why I was going to
ask. In Belize, obviously enough, we have very limited people who know all this. You do have a few. And very limited resources on how to give. And then it's an expensive thing because it's privately done. And the many resources some countries have, we don't have. Right? We don't have like specialized centers just for this. Well, next thing, not just we say about the older folks that we need to have like a daycare center and all that. Well, the same thing with these kids.
Specialized care.
We don't have specialized care for it. So the families have to do it themselves.
Yeah. So what can parents, caregivers do when they are dealing with the best care practice for an autistic child?
You have to know, because they have behavioral issues a lot of time when they're more severe, right? So you have to learn how to deal with, and you have a lot of resources on the internet.
Yeah, I'm sure.
How to deal with with tantrums, with aggressiveness, with agitation. That parents in Belize go on the internet and look up all these things.
You
right?
know, doctor, what fascinated me, and it's probably stuck in my mind for over 25 years, when I saw the movie with Dustin Hoffman and the other actor, Rain Man. And he had this mathematical ability. You remember he went into Las Vegas and he win up everything because he just had this way of looking at numbers and understanding numbers. How realistic is that?
So you do have some autistic kids, not a lot, but you have, who have, because they've channeled their sensory input into such a special area, that all the brain concentration and brain neurons get concentrated in one area. They're very brilliant in that area, in math or music or literature, whatever area it is, right? So they get very brilliant. They're geniuses in that area, right? But that is not like all autistic kids. That's a little amount, a small percentage.
But can you notice that in your child? And enhance that in any way?
Yes, because some kids are really good at music, for example.
Okay,
right? They learn to, my son learn to read music on his own, can play basically any instrument.
Wow.
Right? Can fix phones and computers.
And he's only 18 or 19?
No, he's 21.
21 years old.
And
you never taught him, he never went to no school?
No, he went to school.
No, I'm saying he learned it.
No, he learned it on his own.
On his own, that's what I'm
right.
saying. Yeah.
So, no, that is not what he wants to do. But that is a gift he has. Right? He's really good at that. Because that relaxes him, so his brain is channeled into just that. Because that relaxes him.
Right.
So different things of that nature relaxes certain kids. So they become very brilliant at what that area is. But not all of them are like that. But I just said 70% of these kids have normal intelligence. And of that 70%, you have a little percentage that's all over who are extremely bright. Right?
So for those of us who have autistic children or relatives, or we are caregivers to those, we ought not to be in any kind of panic or afraid, because we are able to raise that child to the best of his or her.
Yes, that is where the family support comes in, and the therapy.
In other words, we ought not to panic and pull out.
We have to deal with it. You have to find the proper therapies that you need. If you need speech, if you need something to help with certain behavior, if you need something to help with certain school things, The problem, like I said, is the resources we have are very limited.
Always limited.
Publicly, right? Because privately you have some resources, but that costs a lot of money.
Well, let me just go, and this is our last question, Doc, and I really appreciate you spending this quality time, because it's invaluable, really, it's invaluable. But what you're saying is that we ought not to be concerned about this rhetoric coming out of the United States about Tylenol, high level, what they call it, extra strength Tylenol being a problem for pregnant women.
That is junk medicine.
All right, so that's junk.
That's stupidness.
And also this idea that, and I say this particularly after the pandemic, the COVID pandemic, where so many people were anti-vaccine. Even here in Belize, we had the big debate with government itself being sued for forcing people to do what they did not want to do in terms of injecting themselves or having themselves injected with vaccine. So please clarify for us, as it relates to children, that the MMR, the measles, mumps, and rubella, which all of our children get routinely, does not cause autism.
It's totally safe.
All right, so we ought not to be even concerned about that. That's vaccines save lives, right? Yeah.
Okay. But unfortunately, in any population, you will always have people who don't go with the current thinking. And you have to respect everybody's opinions. But actually, I would think some of these people who think that way just live in a different world. Right?
But I mean, we do know that the pharmaceuticals and in fact the grand conspiracy of those who do not mean us any good is not a false narrative. There are some, we can find some proof of that. So shouldn't people have at least a question in their mind in regards to the safety of these?
That is why you go and you look for the evidence for the safety of things.
Okay.
And everybody has access to internet now.
Okay. Check the facts.
Check the facts. The only problem is you have to know when you're checking the correct facts. So you go to reputable places to check. You know, just Google anything and when anything will come up, you'll read. Because 80% of the time you won't get junk.
Do we have anything local where we can, certainly in the United States, I consider that local, that they could go on the internet and get anything out of the American Medical Association? Do we have anything local?
I don't know.
We don't have that.
I don't believe so. No.
Okay.
Right.
Do you think there's a need for that, to localize our own situation? See, because when you spoke today, and this is part of your skill, you're blessed with this, you don't speak like you're out, you speak very specific to our situation that we face here, which is a quality that a lot of doctors don't have. So we do need to have our medical
We need to have our own research. Yes.
This is what I said.
Right. We need to have that.
Yeah.
We need to have our own research
Do you think this will come out of the medical efforts that will be done in the UB, because there's a plan to put the UB?
Well, they're starting a medical school.
Okay.
A start is always good for anything. It would take many years, decades before they reach a point, I would think, where you need to get. Because that is just how life works. Now we start small and we gradually build on it.
Yeah. But does it exist in the Caribbean, for example? Does it?
UWI has research things, yes.
Right.
UWI,
Okay.
University of West Indies, yes. And the what's the name of this university in Grenada? St. George's, they have some research capabilities for their students, right? It's an offshore medical school. I don't know of any other that do it, but the Ministry of Health has personnel, I would think, and they could invest on doing much better research because they have the resources, the money, right? Everything has money, right?
Everything has.
Obviously, you have to spend the money properly, which I believe we seem not to be able to do at no level, no? For some reason, no, we just think money out of waste.
I want to draw you into the political thing, but I want to try to avoid that right now. Doctor, let me give you your last word. We're way over the time limit, but please take a moment to say anything that you didn't say.
Nuri, I want to thank you again and thank whoever is listening, that they kind of understand that vaccines are very safe, and for all the women out there who are equals to men, which some people think not, and that Tylenol or acetaminophen or paracetamol is very safe, and that is just the message that we need to leave, that those things are safe.
Okay.
And if you have any concerns, always seek your doctor, your family doctor, whoever, if you have any concerns about anything on any issue. And most doctors would channel patients to me if they need it. That's good. So your fraternity among yourselves is... Well, I try and help people like on the phone, on text. When they see me, I try and help other doctors. So I have like a little rapport with many doctors. That's your. I try and help people.
Right? Yeah, that is great. All right, thank you very much, Dr.